All right, welcome back. We're really excited to have you have this panel. I'm super pumped because we have some really great information. And so the name of our panel is Behavior in Charge. It's not as simple as ABC. I'm going to let folks introduce themselves. We are a little on a time delay for one of our presenters, but we'll have who's here and then we'll kind of go with the flow. So let's start, Sean.
Hi, I'm Sean Herrick, and I have a 15-year-old son, Cole, who has Charge syndrome. He is amazing. So anyway, we have been coming to Cincinnati Children since he was about 7 months of age for his medical care. And then we've been seeing Dr. Wiley since he was probably 5 or 6 years old. And she's been helping us manage some of his more challenging behaviors. And then she's also following his development with Charge syndrome. Thankfully, Cole's overall health and behavior have really improved over time, and we've been using a team approach to intervention. So thank you for having me.
Oh, we're really glad you're here. And I just say that I've learned as much from Mrs. Herrick. I feel funny calling you by a first name. I don't know. And you can certainly call me by first name as probably any other family I have. So next we have Lily.
Hi, my name is Lily Slavin. I am a school psychology doctoral candidate at Central Michigan University. I've been researching Charge syndrome since 2016 with Tim Hartshorn, who is one of the leading psychologists in researching behavior in Charge. So I've learned a lot from him and a lot from the parents and professionals that I've had the opportunity to collaborate with. So I'm really honored to be part of this panel. I'm really excited to have this conversation today.
Yeah, and Lily spent some time this last summer with us, and just love getting to see her meet with families and what she's contributed. So if you are doing this in a discoordinated way, make sure you see her presentation from the last one on the IEP checklist that she's built. I'm Susan Wiley. I'm a developmental pediatrician at Cincinnati Children's, and Dr. Laura is how we will introduce her, but when she gets here, she is, awesome. Yay! So Dr. Laura also works within our developmental and developmental disabilities. I don't even know my own division's name. Division of Developmental and Behavioral Pediatrics, and we'll let Dr. Laura introduce herself.
Good morning, everybody. I excuse my tardiness. I had a phone call with a family and then, of course, got myself turned around. So I am a staff psychologist at the hospital, and I work with kids who have high-risk behaviors, like self-injurious behavior and aggressive behavior. And I'm really excited to be here today to be a part of this presentation.
Yeah, so, and again, I have worked closely with all of the panel members, and you are in for a great opportunity to learn tons. So some of the things we just thought we'd make sure you kind of know what we're going to be covering a little bit is trying to understand some of the triggers of behaviors in children with Charge and how these behaviors can look different in different settings, how we can use things like functional behavioral assessments and behavioral analysis that helps build some approaches to managing behavior, as well as some strategies to address behavioral concerns. And I think hopefully what you'll see is these are folks who know Charge and can give some really concrete approaches for folks. What I also want to make sure, and I know it's kind of feels funny for me being virtual, is that we really do want questions, and we are okay with questions in the middle of our sentences. So you can use the chat box to share with each other, and then there is the private box if you just want a question. That question gets fed to me, and I'll interrupt as we go. So we're going to start with Mrs. Herrick.
So I'm Sean, and I wanted to offer the parents' perspective, so on behavior in our family. So I thought I would start because I'm going to be using Cole and our family as an example in a lot of these things. So the first picture is of Cole in the NICU still right after he got his trach. The bottom couple pictures with the three of us are my husband Raymond and Cole. And then the other pictures, Cole is holding his little brother Parker right after Parker was born. And then there's a more recent picture of Parker and Cole just kind of being silly at the beach. The one in the middle is our recent trip to North Carolina for our family vacation. And I wanted to highlight Snoopy. He is our family dog, but he is also an integral part of helping Cole reduce his anxiety. He's actually Cole's service dog as well. So I think he reduces all of our anxiety.
And I've gotten to meet him too.
Yeah, he's pretty awesome. So, but also I wanted to highlight one picture on here because we're talking about behavior. And so if you look at the picture of Cole right after he got his trach, prior to getting his trach, he was a dusky color. He was fussy. He was described by a lot of people as difficult to calm, and they didn't know, what was going on. This was soon after he got his trach. His coloring looks amazing, and he was sleeping. That was probably one of the first times he slept. So we're very thankful that he got his trach then, because he could finally breathe. So I think that's really important to think about when you're thinking about what his behavior was trying to tell us. And then also, I just kind of wanted to say that I'm pretty sure if we had been at Cincinnati Children's, he would have been trached quite a bit sooner. But anyway, but we are still grateful that he got his trach and he's doing well. So when we think about behavior, all behavior is communication. And so I put a bunch of pictures up here because I really wanted to represent Cole and looking at those pictures, because he's communicating with his facial expressions all different types of emotions. So, in one, he's being really silly. One, he's kind of a mess because he was having a great time at camp and he absolutely loves being messy. The other one where he's kind of sitting with the dog, he was getting ready to have surgery and he was probably worried, anxious, and a little bit sad. And you can see Snoopy giving him comfort there. The next one with the hose, he was being mischievous. That was actually right before he squirted me with the hose. He was quite happy with himself about that. And then another picture of him just really excited. And then the one where he's in the orange shirt, that is, if you look at his face, he's incredibly tense. He was very, very anxious because I had him passing out things at a Cincinnati conference. And he wasn't real happy with me because he doesn't really like to talk to people he doesn't know. So anyway.
It's before pre-teenager smile.
Yeah.
Yep.
Okay, let's see. All right, and we'll go ahead and then, So in here, I wanted to talk about some examples of Cole's more challenging behaviors that we've had throughout the years. So I want you to look at the list and really kind of think about why, what some of the reasons might be that he did these behaviors. What could have the reasons been? Maybe why was he engaging in those behaviors? And then after I talk about each of those behaviors, I want to plug in a key word that kind of goes with what I'm trying to represent with each of those behaviors of what Cole's trying to communicate. Because I think these keywords, or I know these keywords are going to come up throughout our talk. So I wanted you to be able to have some examples to refer back to with those keywords. So, and then also what I'm hoping with that is that will give you guidance in how to ultimately come up with the interventions and strategies that you need. So the first one, Cole broke the TV. He was really upset because he was trying to work the remote and it wasn't working the way that he wanted it to. So he couldn't get the program up. So he took his remote and chucked it at the TV. So he broke our big screen TV because he was really upset that it wasn't doing what he wanted. So the key word that I was thinking of here is he was looking for a tangible reward of having the TV and it wasn't working. So the next one, he urinated on the principal. That was lots of fun. So anyway, the principal, he wasn't at the time really sure how to interact with Cole. So he was actually holding Cole or restraining him because Cole was having some challenging behaviors. And Cole actually told the principal, he said, "I'm going to pee on you if you don't let me go." Principal didn't let him go.
That's fair warning.
Yeah, he did. And he peed on him. So I think that actually was very effective for Cole. Not ideal, but
He got let out of the hold, I bet.
So he, it was really effective and he escaped. So that was your key word there. He was trying to escape. So, and it worked well for him. The next one, pulling the fire alarm. Cole is very, very curious. He always wants to know how things work, even if I tell him it's dangerous, that you shouldn't touch it. He wants to know. So he wanted to see what happened if he pulled the fire alarm. So it was cause and effect. And the other thing that happened was he got a lot of negative attention from his teachers and from everybody in the building, as well as the fire department came. So he actually pulled the fire alarm a few more times because he really liked the attention that he was getting. So that would be an example of doing something, a behavior, because he wanted the attention or liked the attention, even though it was negative. At one of his schools, he was refusing to walk down the hallway, and he was afraid to walk without assistance because he has really decreased balance and he has low vision. So this was driven by anxiety. So he would not move unless somebody was helping him or he had support. Hitting his ear. We have learned that when he's hitting his ear repetitively, that's a sign that he is either has an ear infection or is probably getting ready to have an ear infection or has some fluid in his ear. So that's more of an example of the medical and physical pain. Walking in circles. Cole walks in circles all the time, and this really helps to regulate him and to calm him. To some people, they may think it looks a little odd if he's just pacing or walking in circles, but this is an acceptable strategy for us. It works really well for him, so we don't worry about that at all. And that was actually more of an example of trying to meet one of his sensory needs. Repetitive question asking and related to some of his OCD, so obsessive compulsive disorder, because he's going to tell me everything he's going to do at every moment of every day. So he will say, I'm going to go to the bathroom, or I'm going to go upstairs, or what should I wear today, or things that he actually knows the answers to. He will ask over and over, and if I don't respond to him, he gets more and more probably anxious and starts raising his voice till it becomes a yell. We are working on this, and we're trying to do it by feigning, so it depends on the day if I can ignore it long enough for it to stop or not, or redirect it sometimes. And then this is why the picture of one of his doctors is up here. One of our very first meetings with one of the doctors at Cincinnati, Dr. Dialicon, Cole actually bit him. So Dr. Dialicon was scoping Cole. He had to put a video scope down his nose to look at his swallow. So as we were sitting there getting the results to what happened with his swallow and what it looked like, Cole, very calculated, walked over and weaseled through lots of people and bit Dr. Dialicon on the leg, and I was mortified. So anyway,
I bet you're not the only one in this conference who virtually has had similar experiences.
Yeah, it was
but yes.
So that would be an example that he was trying to get away
and
from
Dr. I'm just going to say, I think Dr. Dialicon earned it.
Yeah, he did. So after that, they did some relationship building, and he did not scope him for quite a while until he really had to again. And you can see in the picture they like each other, so that was all good.
Awesome. Well, this is a great start to kind of the overview in a large part, and we have a couple of questions that I think will to some degree be answered, but we're going to move next into Dr. Laura, who the two questions are things like, what do I do when somebody asks me 1,000 times the same question, and what do we do about ABA when they are really trying to focus on things like answering questions but not focusing on behavior. So I think we're going to cover some of that, but just to help you know what some of the questions that are coming in, and we're going to take next to to Dr. Laura.
Great. So I think I want to try first to respond to questions because I know that's the content that people are interested in. So the first question was about
repetitive questions.
Okay. I think what Sean is saying is probably the appropriate approach. So behavioral psychologists are notoriously terrible for telling people to ignore everything, but there are certain things like anxiety that if they're completely ignored tend to actually really increase the feeling of anxiety and the rate of behavior associated with anxiety. So you need sort of a gentle pulling back. And I think that's what you're talking about, Sean, when you say trying to do it a little bit less, fading it out. So maybe instead of answering 5 times, you answer 3 times. And then the other part that you need is the brain is kind of stuck in that spot in wanting to talk about that thing So you also need a redirection to help the person focus on something a little bit more appropriate. So I think that's a really great strategy for that particular problem.
I think too, like I've seen families, if it's a question about what's happening, is using those visual schedules to kind of reassure and tell the kid, go check the schedule rather than answer the question.
Yeah.
A lot of times I'll do a redirect, like what you were saying, is if he keeps asking and asking and asking, I'll say, well, what is it that you need to do? And sometimes that will work and sometimes it doesn't, but I think it's fading. It's a slow process and seeing where they are. We've actually gone from really truly he would do it for about 10 times, I would say, and now we're probably down to 3, but this has been over a year and a half, so it takes a long time. The other thing that I think that we can do, if he's in my visual sight and can see me, a lot of times holding up a visual, like I might hold up my finger as a cue to wait just a minute or pause or to
and I
redirect.
think that's so helpful too, because it's still responsive to the fact that he's trying to communicate with you. I think people just become much more anxious when there's no responding, even if you can sort of, I heard you, I'm just kind of doing something else for a moment here. That's a nice, gentle way to respond to.
So can I ask a different question? How do you stay sane with 10 questions down to a year and a half to 3? Because I think that's the other embedded question in
sometimes
this.
Better than others.
Right,
And it's going to truly depend.
Right.
Like there are some days that my tolerance is pretty high and I'm really working on it and I'm purposefully working on it at that time. And then there's other days where I'm not in that space, so I might answer him quicker.
Right.
Or there might be more people in the home, so if we have friends over, I'm not going to let them yell 10 times. I'll probably respond after the first because it's hard. So kind of picking and choosing. The other thing that we've utilized a lot is his behavior therapist and other people on that one. If I have someone else who understands what I'm doing, they can say, your mom's doing something right now. Wait just a minute. She hears you. So it reassures. So also kind of having, and giving him appropriately what it is to do. So wait just a minute. She's going to answer you. Or do you know what to do? So that.
Yeah, those are great ideas.
But yes, it's a challenge.
Yeah.
I
It's so you can forgive yourself when you get frustrated.
Yeah, definitely, because it happens.
I think to say one more thing about that, because this is something that I end up speaking with parents about a lot in clinic, and I think it's a really important thing, is once you have under your belt this experience of, we started very small and we kept going, and through these small changes, we arrived at a larger change that really feels meaningful in our life. That hopefulness and that learning experience for you, I think, is something that can keep you going. So if you're a parent listening to this who's really in the middle of struggling a lot, I hope that Sean makes you feel hopeful today. I think there's a lot of reason to feel hopeful.
Yep.
I believe that the second question, but correct me if I was wrong, is about ABA and when the focus is sort of on like answering questions as opposed to decreasing a problem behavior. I think that families have a right to a therapy that is the therapy that they need. I think that they have a right to be involved in building the goals of therapy. So my recommendation to you would be to go back to your team and say, while working on these questions is something that feels important to me, the bigger priority for me right now is working on this. Can we focus more on this, or what will our plan be for this specific thing that feels like a challenge to me?
Could I add something?
Please.
The other thing I think is that it's really important too to make sure that therapist at that time is meeting those needs. And sometimes I've found Cole's 15 now, so he has outgrown some of his therapists.
Sure.
So he's had some amazing, and we just made a switch and it was actually really hard. He had an amazing behavior therapist, and she was right for him at that time. And she was with him for probably, years. And so it was very hard for us to realize that her expertise was with younger kids, and as he was making this transition into adulthood, we actually needed the support of someone else, and we were able, thankfully, to find a really good fit. And it was a hard transition for us because we loved her, but it was the right one and at the right time. So also kind of being okay, because I think sometimes you get into personal relationships with people, and it's good. But sometimes there might be other changes, and that may not be the case. But
That's a great point,
you
though.
know, looking at those things.
That is a really great point. So to come back to the slides now, I think another thing that Sean said that is really important is that behavior communicates. I know that it is very easy to feel that behavior is personally directed at you, and families have shared that with me a lot. But if we get into this mindset that behavior is trying to say something, it can put us in a better headspace to try to think about, this behavior is really telling me something about what this person is thinking, what they're feeling, what they want, or what they need. I'm going to talk about a few different categories that are often the things that people are wanting or feeling or need that keep behaviors going over time. And I want to really highlight this category that's listed for you right now, which is this non-social automatic category. This is behavior that feels good to someone, or it minimizes unpleasant feelings that are going on inside of the person. It's not driven by anything that's going on in the environment specifically. It's more about something that's happening on the inside. What the behavior might be saying is it might be saying, this feels good to me, or this makes me feel better. There are different things that we can try when we understand what the behavior is communicating. So if the behavior is communicating, this feels really good to me, we might say to ourselves, is there something safer that would also feel really good? That's something we can try. If the behavior is saying, this hurts me, like when Cole's hitting his ear, then we try to get treatment so that he doesn't have that feeling of pain inside anymore. And if the behavior is saying, I feel really nervous right now, then we want to try to either teach the person some relaxation strategies to help them cope, or maybe do other things to help them understand what's expected in the situation. The pictures that you showed, Sean, were tremendous. And I especially love the one where he, the dog is with him, Snoopy is with him, right? Trying to help him be comforted when he's getting ready to go into something that's scary. And the look on his face was definitely one of feeling really anxious. And I'm sure that there were a lot of things that people did in terms of explaining to him what was going to happen. So there are many things we can do to help people with feelings that happen on the inside of them.
So one of the questions that kind of speaks a little to this, because it's a lot of sensory stimulation, is my child has a lot of sensory seeking behaviors, and I understand they're for a purpose, but he never gets his fill. He just seeks more and more and more, and it's hard to get him to calm down. And he's even started hyperventilating from being so kind of high. How do we help him manage sensory seeking behaviors that are challenging? It's getting difficult as he's getting older. It's harder to physically manage that.
I think that, and I would love for anyone to jump in too. One thing that I notice that parents are really great at is they spend so much time with their child, so they sort of know about the activities that tend to get their child really high, and they know about the activities that tend to be more relaxing. If you can just watch and find some of those activities, sometimes you can redirect to something when you see someone sort of going down a pathway where they're kind of getting too dysregulated or too excited. And I think that that can be a nice strategy that can be done sort of naturally. Again, this is a place where if it's appropriate and the person can understand it, we can teach some relaxation strategies too, and sort of embed those across the day to try to help the person be sort of at a lower level of arousal.
And then I was going to add too, and it sounds like this child might be a little bit older, and so we have flowed in and out of therapies, and so it may be that an occupational therapist, if you're not already connected, that you should get connected with them to help find some of those calming type of things. Also, if you are, maybe ask about trying some things. I know some things that really work with Cole is if he is overactive and really excitable for a period of time, that's really hard. And he just does heighten. And so some of the things for him that really work is his room is kind of like, we've created that to be his sanctuary. So we plan breaks in there to help him, and this has also been over time, but to help him find ways to calm down. And then the other thing for him, and it seems like it's for a lot of kids or people in general that kind of escalate with with that kind of the hyperactivity and things like that, the proprioception or that deep pressure input tends to be really helping and calming. But I also like the suggestion of just observing.
And Lily's going to talk a little bit more too about some of that sensory threshold and kind of self-regulation, which is often really a challenge in a lot of kids with charge.
All right. This is another reason that people engage in behavior, not just people with charge, not just people with developmental concerns, but all people would like to get attention from other people. You will know that behavior is communicating for attention if you sort of watch this behavior and the behavior is sort of saying, look at me, see me right now. We can teach people to ask for attention in better ways if they're using behavior to get attention in an inappropriate way. And another thing that when we were preparing for the presentation, Sean brought up that I think is a really important thing is we can really be focused more in general on what we want people to do as opposed to what we want them not to do. We sort of get trained to say things like, stop, no, don't do that. But what that communicates to a person is what I'm doing right now really bothers you and it's working awesome to get your attention. What we would like to try to do instead is talk to people about what we want to see them do. So if you see a person pick up a remote, like they're going to throw it, you can try saying, hey, could you hand that to me pretty calmly? And if you do, and they do in fact do what you ask them to do, you just turn the whole situation over. You made it something that you can praise about instead of something that you're going to have to quote unquote punish.
It's so hard to remember to do that.
It is. It really,
It
really
takes
is.
some training.
It
actually,
does. Yeah, from the
because
parent.
Our brains are trained to say don't, stop. So it really did when I started putting that into practice. I had to consciously think about, and still sometimes do, to word it in what I want. Like, give me the remote, put the remote down, rather than stop, don't. Not that I still don't do those things.
And that's true for typically developing kids too,
Yes.
and your spouses and other critical members of your circle.
Yes.
I wanted to add, I think that's especially important for kids with charge because they are very concrete thinkers. So if you just say, don't throw the remote, that gives them hundreds of possibilities for what to do. So the more explicit that we can be in setting them some guidelines for this is how we would like you to act, and here's all the good things that are going to happen if you act that way, then that's going to be really helpful for them in learning those positive behavioral responses.
Another reason that all people engage in behavior is to get out of situations or delay even situations that feel scary or that they just don't enjoy. And the behavior will communicate, I don't like this. I don't want to be here right now. We can teach people to ask for breaks. We do that kind of thing. I think more often adults come up with excuses more than asking for breaks, but we could teach people to do that. And then another important piece, and I like, Sean, that you brought up the story too about, I think you were having him pass something out at a conference, right? There are lots of things in life that we don't like, but we find out after we do that thing that it was good and it was a learning experience for us. So we don't want to help people avoid all things, but we want to put them in an amount of the situation that they can be successful in. And we want to teach them over time to be able to tolerate more and more so that they can do as many things or participate in as many things as they possibly can. Another thing that we can do, and which we also do for ourselves, is we can do things to make it easier for us to cope in a situation that's challenging. You know, one thing that really helps my coping here is that I had the opportunity to meet everyone here. I'm working with people who are smiling at me and nodding at me. That's an environmental support that you guys are providing me right now. For kids who have a really different sensory experience, maybe the environmental support they need is an environment that is dimmer. Maybe the environmental support they need to be successful going to the grocery store is going on off hours when it's not totally chaotic. So there's lots we can do to make it more pleasant in the environment. And if it's a task that is challenging, we can try to decrease the difficulty of the task. We can do less of it. We can offer more help. And last is tangible. This is the behavior that says, I want that thing, give it to me right now. Again, we can teach people to ask for things instead of grabbing them from us. We can teach lots of good behaviors. And at some point in time, it is really important to teach people to wait because inevitably the thing that a person likes the most is not immediately available at all times.
We have two questions, so thank you all for asking questions. I'm going to start with the one that asks, what might be a good correction for kicking the walls? This is in a three-year-old.
So I always try to think about opposite action. So if someone is kicking with their feet in the wall, I need something that is incompatible with that. So I might say something like, come sit here with me right now, and have the seat be someplace that's away from the wall. That's the first one that comes to mind.
Yeah, and I think too, sometimes that's a sensory input. And so that can be a sensory input. It can be a frustration. So you have to step back and figure out what's
That's what I'm
causing it.
thinking.
And then if it's a sensory thing, there might be some other ways to find a sensory input of that foot input, because a lot of kids love laying on the floor, getting that kind of rocking, head banging. There's a lot of things that kids with charge can do, and it actually goes back to that feeling good. I think Lily looks like she's ready.
Yes.
Yeah.
I was thinking, and if they really want the kicking motion, can we teach them to ask to go outside and kick a soccer ball, or so they're getting that same input and it's more appropriate and it's more fun, or can we have them jump up and down, get that really strong input on their feet? I think I like the suggestions that you guys said too. I think
Yeah, I talked to a lot of families about, and even like schools about, all of a sudden my child's laying on the ground and kind of kicking. And you'll see that at charge conferences all the time. And I'm like, look, they need to get their body in awareness and space. They need that input. It's a little break and then it's over. It's not hurting anyone. It may look funny in places and you have to kind of figure that out for yourself. But if it's not causing harm, let it go, get it done, then move on. And yeah.
I even wonder if you could pair it up with something that's really fun. Like if the person likes singing, maybe you could do a happy and it, and there's the stomp your feet part. And maybe you can get them to ask for that, to recognize when they need that input.
Yeah, and if it's hard for the child, if they're not yet at a standing and it's sensory seeking,
Absolutely.
you could even use the music where they've got those floor pads. You could put them on the walls or things like that.
Yeah, those little foot pianos or something.
Something like that. But if it's out of frustration or being upset, then we would look at some of the different things that we've been talking about as far as, how to address it.
Great. Yeah, I think that's you guys covered a lot of areas there. There is a question about ABA in medicine, but I think we're going to kind of fit that in a little bit later. So we're going to move ahead, but I promise to answer that one.
All right, so moving into more internal influencers on behavior and charge. And it's really helpful to have that more environmental perspective when thinking about tangibles and attention and what are they receiving from the environment from doing these specific behaviors. But charge is extremely complex and there's a lot going on inside these kids. So there's so much that we need to be really tuned into when we're trying to figure out why is this behavior happening. So the first I wanted to talk about is pain. And we know that individuals with charge experience pretty high levels of pain or pretty chronic pain throughout their life. They have so many surgeries early in life and they have ongoing medical conditions that can really come out of nowhere. So if we ever see a sudden change in behavior or something that's really abnormal or really extreme, pain is really one of the first things that we want to look for, because that can be an indicator to us that something is going on beyond just what they're immediately receiving from the environment. And with that, it's really important to try to figure out what are their common pain behaviors. So I'm sure as parents, you've figured out so many very, very subtle behavioral changes that indicate even to the very specific, where they're hurting. So I know Tim's son, Jacob, who is 32 now, I believe he's 31 or 32. He has a very specific behavior of jamming things right into his neck when he has an earache. So that's the only time that behavior comes out. So they know that when he's doing that, he's in pain and they need to get him to the doctor. So it's really important to try to figure out what are these really nuanced behaviors and when do we need to seek medical attention before pursuing some other ways of addressing the behavior. And once we can start to figure out these behaviors are associated with specific types of pain, how can we teach them a way to communicate that is understandable to more people than just their parents, because parents are going to be really good at figuring out those really minute details, but like school professionals or outside providers like at ABA, they might not know as much that behavior means something very purposeful for the child. So if we can teach them a way of a really low effort way of communicating the same thing, that can be really helpful in expanding their communication and helping us know when they're in pain. So one example that I heard from a school team is the school team worked with a student to sign medicine when she was in pain. And that is a pretty low effort. It only requires putting your hands together. And that was a way that they can communicate. And so she didn't need to do some of the more aggressive behaviors that she was doing previously. So with pain, we should always be considering that, and we should always be working very collaboratively with your medical providers to ensure that there is not something really painful happening.
Yeah, I've also seen families kind of do like a little, here's the behaviors and here's what it means for school teams, so that they really kind of have that like recipe book of understanding.
Yeah, I would definitely recommend that. I think those communication books that you can put together can be really helpful, because it's going to be really frustrating for your child if at home you are super attentive to their very subtle behavioral changes and you're meeting their needs at home. But then when they go to school, if those needs are not being met, then those behaviors are only going to escalate, because now they're saying, okay, well, they're not getting it. I need to do more and more and more. And that's when we can start to see some more of those bigger, more dangerous or aggressive behaviors.
Well, and talk about something that would increase your anxiety substantially. If you know people understand me in this environment, but suddenly I'm not understood at all. Oh.
Right. Yeah. And so that brings me to anxiety, which is our next piece. A nice transition.
Perfect, like slide in.
With anxiety, we also know that individuals with charge exhibit pretty high levels of anxiety. And that can be due to, they've had a lot of anxiety-inducing things happen to them, especially early in life with all of the medical procedures coming in and out of the hospital. That can be really scary. And also, working with school teams or all these different professionals who maybe don't understand them as well, that can be really, really hard. And on top of all of that, a lot of their worlds can be very unpredictable. So if we don't have a good way of communicating with them, and suddenly it's time to go to school and they're just being rushed off, put in a car and going somewhere that they have no idea where they're going, I think any of us would be pretty nervous about that. So with this, it's so important to make their lives as predictable as we can and do it in ways that are accessible to them. So we can tell them, oh, we're going to the doctor, we're going to the doctor, but are they really going to be able to process that? How many other things can we pair it with, like a visual and tactile schedule, so they know, okay, this means I'm going to the doctor, I know what's going to happen here, and just kind of make some order to their lives, so they can prepare a little bit more. And something I wanted to add, like visual schedules were brought up earlier in terms of the repetitive questions. And I think with anxiety and the need to really know what's happening, the more that we can help these kids be independent in answering those questions for themselves, the more successful they'll be. So for example, with asking questions, if they don't have a way of answering the question themselves, then of course they're going to ask someone else. So for me, coming down here to do this presentation, I was nervous about it, and I probably checked the email that was all laid out with what's happening, where do you mean? I probably checked that at least 20 times, because that was something that I could do independently. If I didn't have that, I would probably be emailing my co-presenters every couple minutes. Hey, what are we doing for this? What are we doing for this? But I was able to independently check that. So if there's things that we can do, like making a very accessible schedule or making their lives very predictable, then that can help them just know what to expect and just automatically reduce some of that anxiety.
So this isn't a question, but it comes up, is that my kid does great with routine, but then when the routine changes, how do I prepare him for that? So I think that's another thing to think about.
Yeah, and I think with that, if you have a really good routine in place, working in a way of communicating when there's a change in routine.
Absolutely.
So for example, if you have a visual schedule and you typically go to school on Monday, but school is canceled that day, can you have a something that goes over that's like an X that says, okay, this is canceled today. And then can you have some conversation about why that's happening? Can you incorporate something like a social story? Like, oh, typically we go to school on Mondays and we do this, but today is Martin Luther King Jr. Day. So we don't have school today, and here's what we're going to do instead. So they still know, because that can be anxiety inducing too. If you know, typically I do this, well, if I'm not doing that, where am I supposed to go? What am I going to be doing? So if you can lay out to them, okay, this is what we typically do, here's what we are doing, it can help give them a little bit of order there.
And I think you can do levels of that too, because it's hard to teach a change in the moment when it's happening. So you can plan ahead and you can start putting this icon that means change on the schedule, and you can make it a good change. Like, we were going to do some work, but now change, we're going swimming. And then you can make the changes neutral, and then you can make them ones maybe that won't always be preferred. But teaching that in advance, I think, is anxiety decreasing.
And we've actually done that.
Oh,
That's what, we have practiced that change. Ours was a question mark in the schedule, and it was purposely there. And that question mark meant that we don't know what we're going to do then.
Yeah.
And we did pair it with something that he'd like to do. And then over time, now we can put a question mark in the schedule, and most of the time he can be flexible with the change. It depends what the change is. Sometimes it's still hard, but we've really had to practice it ahead of time.
And I encourage families to ask their IEP team to work on that a little bit at school as well, so it doesn't always fall at home, but in a day that we know is a good day and a very planful manner. So, yeah.
Oh, wait, can we go back one?
Oh, yes, sorry. Yep. Oops. Oh, there we go.
Yeah, which I'll continue this.
I just gave everybody a seizure at home.
So the last piece of the triangle is sensory issues, and that kind of really goes along with what we've been touching on with pain and anxiety too. With sensory, there's so much information that individuals with charge are missing out on from the environment, so it can really make the environment pretty unpredictable for them. And also, they experience the world in a very different way from people with typically developing senses. So they might be doing some atypical behaviors that we might say, like, oh, why are you doing that? But it's serving a really important sensory function for them. I think a prime example of this is the need of a lot of kids with charge to lay upside down. And I don't go and lay upside down after a day of school, but for kids with charge, that can really help them just regulate their senses and regulate their emotions, and they've learned to do that because it really helps them cope with their day to day. And I'll go a little bit more into sense. Yeah,
so that kind of links to a question. I'm just trying to fly these in here when it makes sense. 2 behaviors that are not harmful per se, but noticeable and can maybe be redirected: banging heels on the floor and flapping arms. Any suggestions for redirection? And I think, again, I kind of think about, do we need to, or is there an alternative thing that gives that sensory input? So it goes back to that why. But
right, yeah, and I think that's really hard, because I think especially there's different expectations for different settings. So at school, especially, teachers might not be as accepting of hand flapping behavior or
at the grocery store or
right. But what we need to be careful about is that we don't just not let them do those things, because that is the way that they figured out to self-regulate themselves. So if we take that away without giving them another avenue to help them regulate themselves, then you're probably going to end up seeing even more escalated behavior.
Yeah. I had a family recently tell me they watched the webinar from an OT on sensory stuff on the Charge Foundation and went, oh, I had been worried about this flapping and now I'm not. So that's a good resource for folks if you wanted to learn a little bit more about it.
Yeah, and I think too, going on with that, just kind of, there's some things that we can do with just shifting our perspectives for what we're thinking of the behavior. So if we think of the hand flapping as, oh, that's so annoying, why are they doing that? Then we're going to think about that very differently than if we take the perspective of, oh, cool, that's so awesome. They learned a way to calm down, and look, they're doing it in a way that's not hurting anyone else. Like, that's awesome. So I think, of course, there's going to be some situations in which that's not appropriate, but I think there are some things that we can do on our end to change the way that we're thinking about how and why they're doing things.
And then I was going to add.
Go ahead.
No, I was just going to add that when it's appropriate, sometimes you're able to teach some things that are, socially accepting, like, or acceptable in those settings. Like, for example, you had talked about kicking the ball. That might be not for the hand flapping necessarily, but something that would be socially acceptable in different settings. And then the other thing, sometimes over time, like where Cole has learned certain things, he actually now mostly just paces at home, and we're okay. He's been able to, but we build those breaks in for him. So those are built in no matter where we go, so that he can do some of those type of things that might look odd to other people out in the different environments. He has a place and he still has an outlet for those. But then also I think what they were talking about is definitely educating the team and people around, because if it really is working and it's not hurting anyone, and it's helping them regulate and helping them function, trying to look at all those things.
I second all of that. I know that I have had some parents come in and say to me, I understand my child needs to do this. It really bothers me when it happens in this one spot. Like, I feel really troubled by it. Sometimes the approach that we've taken with that is I'll say, well, it's probably really difficult for your child to discriminate when that is and is not okay. So we give them some sort of a signal to help them understand. Like, when you have this bracelet on, that's fine and you can do it. And when we take it off, if you start to do it, I'm going to ask you to do something different. So they start to learn when it's available and when it's not.
That's a great idea.
It's cool. I like that.
So, talking more about sensory issues in charge, it can be really hard to make sense of the sensory needs of these kids, because at sometimes it seems like they are really seeking out all these different sensory inputs, and they're trying to get as much as they can. I think that came through in one of the questions. Like, my child, it's never enough. They always want more and more and more. And then sometimes we see these huge meltdowns because it seems like there's just one piece of sensory input that's just been too much. So I think it's really what we need to do is be very tuned into the environment and try to figure out what sensations are they seeking, and at what points are they seeking those, and when what are some cues that we know that these are typically really difficult situations for them, and we really need to minimize sensory input in that time. So, like, for example, if they are really escalating and having a really hard time regulating themselves, is that a time where we need to really take away sensory input because they're really overloaded, versus are there times where they're really not able to focus and we need to amp it up so that they're able to really attend to the environment.
And Lily, can I ask you a question about that I feel like comes up a lot? Do you think that the best way to understand if you're doing the right thing is really to try it for a period of time and kind of watch to see how the person is responding?
Mm-hmm.
Okay.
Yeah, no, I think so. I think we're not going to get it perfect on the first time. Yeah. These kids are really complex. There's a lot going on. We can't possibly know what's going on inside them at every moment of the day. So I think there is going to be a lot of trial and error, and it takes really paying attention to what's happening in the environment. What are the patterns of pain behaviors, or what are common triggers that I know? So trying to be as attuned into everything that's going on as possible can be really helpful, because it's hard. I'm sure you can speak to that, Sean.
It is.
Yeah. So I'm trying to figure out our timing of content and questions, but let me hit a question. Probably there are some on medication and when to start meds. So again, I'm going to put those a little aside for just a bit, but we'll come back to them, I promise. There's one is around a 12-year-old son who is correcting his siblings, and he might yell at them or grab or pull them to stop them from what he doesn't want them to do. Any thoughts on how to, because I think, and I would actually expand that out to sometimes siblings inadvertently reinforce behaviors. So there may be some training of the siblings, and that may vary based on their age and impulse control and personal state in that moment. So let's start with that one, and then I'll pull some others in.
I actually have a super sweet kiddo that I'm working with right now who has just exactly that problem. And what we have realized together, myself and the mom, is that really it's too upsetting by the time we get into that spot. So in this, idea of starting with something that's easier, we're actually starting by having an adult break a rule and making it kind of silly on purpose. And we've written a story about what we want him to do when the rule gets broken. So an adult comes in and breaks a rule. He tells his mom, the mom provides the correction for the person who's breaking the rule. And we're starting at that level. We can see when even adults come in and break rules that he feels very anxious. So we know he's not ready to navigate that situation with his brother who gets him sort of escalated.
That's a great thought. All right. How about, so we also have, how can we help explain to teachers, service providers, and even siblings that their children aren't just being stubborn or manipulative, but these are coping behaviors and part of charge? I've found that people often think that they are doing these behaviors on purpose and can control them.
A lot of education, I think, and
Send them to this webinar.
Yeah.
and David Brown and, and Tim and Lily. Yeah.
But no, I think that just a lot of education of the teams and what works for your child and those type of things is really helpful. We have and the other thing that has been very helpful for us when we've had some teams is we have had I'm from Kentucky, so the Kentucky Deafblind Project has actually come in and helped me do a full education for some of his teams. Or sometimes it might be just at team meetings to where we bring in either information that I got from the Charged Syndrome conferences or websites or things that help to explain and support what I'm saying of why they're doing these things. So that I've made binders before that are specific to Cole, but then also expand that it's backed by research. We've also done videos of Cole in different settings. And now that he's getting older, they have those little like iMovie things out. So he's making his own videos to try to teach people about his preferences, things he likes and he doesn't like, and why he does certain things. And so we'll try to grade those depending on the audience. So he has a younger brother. So for some of those, for his younger brother's friends who don't understand Cole, that video is going to look a little bit different sometimes than it might to his educational team or to friends or family members or parents. So just being creative with that.
Mm-hmm. We also have a question of the drop it, pick it up game is what I would say, is we use cloth wipes to wipe our daughter's saliva. She picks them up and tosses them on the floor. We pick them up, give them back. It becomes a game. How do we redirect that?
This is a hard one. So, I mean, if I had to guess, I haven't done an assessment, but it sounds like it might be a little bit an attention thing. It might also be a little bit just trying to have a game. We all want to have fun interactions with people. So if you can think of some other way to give her a fun interaction with you that's not that, and kind of have it like right after you do the wipe, maybe hang on to that cloth, that might be something to try out.
All right. And then one more question, and then we'll try to move ahead a little bit. How do we aid with anxiety when our kids have to go through medical procedures or exams? No matter how much we explain, the bottom line is they're defensive and react out of fear. I hate holding my child down. How else can we figure out if there's how else can we figure out if there's pain for a medical reason? So then this really expands into other areas, making my child defensive in feeding, diapering, dressing, just because of the trauma from the medical procedures, blood draws, IVs, exams. I don't know who wants to start that. I have some thoughts, but I'll let others start.
So this is actually some new research that's coming out of my lab right now. So one of the graduate students in my lab, Sarah Sykes, is doing her thesis on this topic. So hopefully we'll have some more information from, she's asked, like, what do medical providers do to help make your child feel more comfortable in these settings? I know a lot of the preliminary results have been things like having child life involved and trying to make the procedure as comfortable as possible and as routine based. So can they go ahead of time and kind of explore the environment and see what's going on? Can they become more comfortable that way? How basically anything that they can do to help them understand what's going on, I think is going to be pretty big.
Yeah, we use Child Life a lot at Cincinnati Children's, and exactly that. Do we have some practice runs? Do we figure out what's needed? What's the support for that procedure that isn't just the parent holding them down? And sometimes sometimes because I'm a doctor, we go to medication when it's that anxiety producing. And I'm not saying that's where we start, but we try to understand what a child's really going to need, and sometimes a medicine to kind of lower the anxiety makes that in addition to all that other prep, it goes a little bit more smoothly.
And then I had an example of where this has happened with Cole, and there was the breaking point was when he stayed awake after one of his surgeries for over 48 hours and truly did not sleep. He wanted to sleep. We call it anesthesia now because we don't say you're going to sleep, because he was afraid to fall asleep of what might happen. So it was terrible. And then not only was he not sleeping, once he finally slept, then he was anxious for weeks, months. I mean, it went on bad. And it was spilling over into the rest of our lives. And so what we ended up doing was I actually called Dr. Wiley and talked to Lucy. So if you guys know Lucy with the Charge Center, and because I didn't know what to do. And it was something that I wouldn't have thought of. We actually did a consult with anesthesia, and that was hugely helpful. What we found is that one of the medications, common anesthesia medication, he was having an adverse reaction that was actually compounding with his anxiety. So it was making him stay awake, and then you add on top of the layer of the anxiety. So we've obviously changed that medication, and that's now in his chart, and they try not to use that. So that's helped. But then we also have a lot of other things now in place that came out. So I mean, we have a truly elaborate plan, and we do the same every single time we have Child Life involved. We bring his dog with us, Snoopy, his service dog. If that's something that would calm the child, I think Cincinnati or other places may have a therapy dog. We do anxiety medicine before we even leave for the hospital now. And like Dr. Wiley said, that's not where you want to start, but when it's getting to this point, you've got to find something. He wears his own pajamas. He brings his own blankets. We have as much as we can do. Sometimes we go into the induction room with him. We were holding him down, and that was horrible to have to try to hold him down. And then that was a whole nother level.
It adds trauma.
Yeah, it did. And so thankfully, we now have a system that we use every time. And we talk about it still every time before he has a procedure. And then after the procedure for Cole, we have found that even anxiety medicines for a time after that have been helpful. And then we talk about it, and I end up usually sleeping in bed with him for the first couple of nights afterwards, or helping him fall asleep. So it can look different, but that was a pretty intense plan that we came up with a lot of people, and it was not what I would have thought of.
And I know that we probably have to move forward, but I want to say super quick, I highly encourage families when they come up with their plan to write it down, because if you have to go to the ED, there won't be lots of prep time. But if you can hand someone a piece of paper and say, these are the absolute things that we do not want you to do, these are the things that are going to help out a lot, that can be a nice intervention to support you in an acute care environment.
That's a really great
I will
point.
be doing that.
Yeah.
I have my own, but I never thought about it
for like this urgent.
Like an emergency or something. I have it for him and for us, but I don't have it written in a way.
Yeah.
So I'm writing it down.
So I'm going to kind of like quickly slide through some of these next few slides that they're really more for resources anyway, just so that you do know that there is a pain assessment for kids with charge who are nonverbal or non-vocal. So just so that you kind of know of these things, we put the link to them. So if that is helpful for you, I always tend to like to put this slide in from Dr. Davenport, because it really, again, that might be something to share with schools. Like, this is really complicated and it isn't straightforward. And then I think too, we've kind of talked a little bit about how do you know if it's pain, and I'm not going to belabor these real deeply, but I do think there's a few things. I tend to think head to toe if I'm going to think through, okay, could it be this? Could it be this? And I kind of hit on a few more common things for kids with charge, things like teeth and, teeth pain, sinus pressure, headaches, ear infections we've talked about. changes in vision and hearing are really important too, because sometimes behaviors can come because the world is now different. If my retina detached or something along those lines. Constipation, GI, bloating, cyclic vomiting, those are always going to make everybody kind of grumpy. Yeah, right. And so these are really things to think about. And I know a lot of families recognize their child's issues with GI stuff. And then sleep. So there's a lot of, if I'm not sleeping well, so even with Cole's experience of not sleeping for 2 days, that's going to make everything worse for everyone. But there's other things that we want to be thinking about. So just, I think, again, those medical providers may be able to help to think through whether that's your primary care pediatrician, somebody like that, to kind of really just walk through, and your child. So that's, we'll slide through that one quickly and move on to how we understand other influences on behavior.
Okay, so when we're looking at trying to figure out why they're doing the behavior, and this is talking more about, we've talked about a lot of the internal, Lily was talking about the internal influences, but these are more of your external. What is in the environment? What is it that maybe we can change of how we react? And so where I start, and sometimes the answer is kind of easy. Dr. Wiley said, your child, but sometimes it's less obvious. And so observations, that's where you want to start. And what happened, so the antecedent, so what happened before the behavior occurred. So for example, when Cole peed on his principal, the principal was holding him. That was the antecedent. The behavior, Cole peed on him. Consequence, Cole got what he wanted. The principal let go of him. So it was effective, but that's obviously not what we want. But that's a good guide to help you.
And I'm just going to say, Cole verbalized first that he was gonna. So
he
gave plenty. I mean, that's
warning.
He did give fair warning.
Yeah, so the principal did not.
I've learned from Dr. Laura,
Yeah.
usually it's us in the environment that has to shift, not necessarily the child.
Yeah, actually, I was kind of proud of Cole,
Yeah,
I have to say, because he told him, he's like, you don't let me go. This is going to happen. So looking at all those things, and then sometimes it's looking at, okay, who's going to be the best person, the best team to help us try to figure out this challenging behavior. Is it more environmental? Is it more internal? So if it's more environmental or us changing around, I think it's important to look at the functional behavior assessment. And then that helps us to create a behavior support plan. And we have found the behavior support plans really, really helpful for Cole. Because what it does for us is it helps me so that I know what to do at that moment, at that time, and it takes the thinking out of it. So I'm not just reacting, or I try not to anyway. And if I'm frustrated, I can try to go back to that plan that I don't have to think about, and it helps me to be more, hopefully, consistent over time.
And these are lifelong plans, right? They stay the same?
No.
But no, I know that was a really rhetorical question. No, but I think schools go, I've made my plan, I'm ready to go, and you're good to go. And So
they definitely change over time and with what the behaviors are and what they need. And sometimes it's more intense, and then sometimes it's less. And so it just kind of depends where he's at for it. So
Yeah, I don't even need to say much about this. This is just an example of exactly what Sean just said. This is a way that you can record this for yourself so you can start to look for some patterns.
And we've kind of touched on this already, but
it's good to recap.
Yeah, I just wanted to
really
briefly go over this again. This is something I learned from, I've heard David Brown talk about a lot, and kind of a hierarchy of where we want to intervene on behavior. Mm-hmm. So first off, is the behavior just kind of annoying? Is it something that they're doing that we don't really like, but it's okay, we can kind of learn to accept it? So for those ones, I'm seeing more as like the sensory coping strategies that they've learned. So I think a good example for this one is we've had a parent reach out to our lab and say that the school was not letting their daughter lay upside down at school, which she really, 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 really needed to do to be able to regulate herself, to be able to get through the school day. And she was having these huge meltdowns when she either at school or as soon as she got home. So the school might not like having her to lay upside down, but if they can give her a couple minutes throughout the day to lay upside down,
It's probably preferable to a meltdown.
yeah,
That's what I'm thinking. I was like, this is your choice. Let her lay upside down.
Yeah, right, exactly.
You know,
right. So
she's
are they little things that we can really learn to accept because that's what they've learned that they need to do. Next, is it disruptive? So can we maybe ignore it in the moment and then gradually start to teach them better ways or more appropriate ways of communicating the same thing? Versus, is it dangerous? We need to stop it in that exact moment, and then also continue to teach those more safe alternatives. So kind of like thinking your way through when you have a behavior, kind of categorizing it like that and thinking about what is the best way to move forward in terms of the urgency versus stopping it in the moment.
I like this framework because the other framework is also across your family. So for example, two parents may have a different idea about what's most important. So trying to kind of get that, what do you both agree is most important? What do you both agree doesn't matter? And we can think about that later. And then what are those more negotiation points?
Mm-hmm.
This is just an example of kind of a plan for keeping someone calm. And what I like about it is that it shows what I think is true about behavior. It's kind of this hill that you climb. And all of us, we reach a point where we're not really rational anymore, and there's not any behavior strategy that's going to improve behavior at that point. That's just the point of crisis management. I think it also helps us remember that it's really important when people are having a good time, when they're down at their normal emotions, that's the time to teach and reward and reinforce. So just a little support for you there.
Yeah, and I think one of the things that I've learned from this, again, not somebody presenting this curve in another forum, is we often think about the first part of the curve and we don't think about the second half of the curve. Mm-hmm. So things are going to happen, and how do we then really look at that de-escalation phase? Mm-hmm. So we have to teach those strategies and, kind of have a plan for that too. So there are some questions, kind of when do we start thinking about medication? And I guess this is where I would say, I know a lot of times families don't want to have to go down a medication path, but I also recognize that there are times when there are brain-based differences. We've talked about this. We've talked about the anxiety level. We've talked about how how kids process and learn differently. But sometimes we actually need a combined approach. And I think when I think about it, I think about safety. What have we tried? What's working? What's not working? Unfortunately, sometimes we have to think about symptoms rather than a real clear diagnosis. So people have asked things about OCD, anxiety, aggression. So unfortunately, we don't have this these are the medicines that target charge. There is no such thing. And it's not very satisfying to say we don't have a clear mental health diagnosis, but we do know these exist within the realm of charge as well. So I think of things like safety, I think of things like quality of life and getting back into the community, and then, kind of taking that conversation with the family. So you are part of that conversation. It should never be a situation where a provider tells you, here's what you're going to do. So when I talk about medication, I usually talk about it in the context of behavioral therapy. What are our behavioral people seeing that helps me target? Is it impulsivity? Is it anxiety? Is it irritability? What's going on? And then we talk through the different types of medications and what we think they're targeting, what the side effects might be, thinking about how they may or may not interfere with other medications or other symptoms. So some medications have a lot of GI side effects, and we want to kind of, think that through. And then it's also really important to have close monitoring. So is it working? Is it helping? Are there side effects? So it's not like here's your script, come back a long time from now. And then the other piece is to really think about are there times when we might think about back and back off? And so once we've built skills, is it a time to try? Is it in the summertime? Is that a better time? Is it in school that is a better time? Kind of talking through when might we think about tapering or stopping medications. I thought it might be helpful. I know, Sean, you've had to go down this path. So kind of what goes in the mind of a family member, kind of, I don't know, you can get on Facebook and people say you shouldn't medicate, and others are like, this was the only thing that saved my family and made it such that we could function. So
I forgot, let me think for a second.
do you have that in your later slides? So
I do, but I wanted to.
Because
I'm
our
trying to
next
think there's a
our next
specific
slides are kind of
example.
like teams and strategies. So
I'm trying to remember my example. Oh, yeah. So this was, we had gotten to a point where, and we were talking about that, where it's the point of just truly no return. And that's where he's irrational. And that's what we call it. It's point of no return. He's not rational. None of the regular strategies are working. He is truly a danger, usually to others, not typically himself, but he can be. And that's where we got. And there was one moment where we really, really struggled, and some things became unsafe in the car. And he had a huge explosion, and we could not get it under control. So now it was not safe for us. It wasn't safe for him. It probably wasn't safe for anybody who was on the road when that was happening. So that was kind of another true aha moment. And we went back to Dr. Wiley, and I was like, this is not working. And so, and we have lots of supports. And I think that's really important, that this isn't the first thing you want to try. You really want to try some of these other things, and you really want to have a crisis management in place, looking at the precursor behaviors, all those types of things. But when those are not working and you're at a true safety concern, you have to have something. So we have what he started a medication, and it's our rescue medication, and it works very, very well. And so if he gets to that point in a return, and we try first to regroup him, because we don't like to have to give it to him. But he knows, we've been able to teach him and educate him that this can help you. And so he takes it, and it does help him relax and calm and regroup. And so now we're back at a stable point. There was a point where he was needing the rescue medication 1 to 2 times a week, which was more than what we would like. And so when that started happening, we went back to Dr. Wiley and talked about what can we do. And we've now found a medication that really helps him stabilize. And I'm happy to say that we haven't needed his rescue medication in quite a while. We still always keep it on hand. We still try to look for any of those precursor behaviors to try to de-escalate, because that's ideally what you want, is to de-escalate him before he gets there. But we have it if we need it. So that's been a huge help.
Yeah, those are great
and
points.
it's safety. I mean, really, when it comes down to safety, where you're going to hurt others. And then that also becomes, you touched on that, is quality of life. If we're dealing with that all the time, the rest of we're stressed, and our quality of life for everyone in our family is not very good at that moment.
Yeah. And there sometimes are like really helpful as needed medication, but then I think it's that kind of, where's your threshold at which, boy, we need something to prevent things rather than be reactive to them. And I
think that
I know
was very
Dr. Lord
helpful.
works a lot with kids who are trying to sort through behavior and medication, and kind of that team is really helpful, that we're talking together, and the family is, of course, the hub. All right. Oh, so speaking of teams.
So I couldn't do this without teams. So we've already talked a lot about teams, and I'm very, very thankful for all of our teams. And when I started to work on this slide, in my mind, I had all these people, all these fantastic people over the years for his team. And so that's what I was planning to put up here. I was going to put up all these people of all of his different teams. But what I realized is I don't really have a picture of his teams and like these cohesive groups, because really what it is, it's the moments. So,
Oh, how sweet.
so thank you all.
Yes.
Because that's what it's about. The teams allow us to have those successful moments. And these are pictures of some of the really successful times in his life. When he was able to walk with his walker, that was an amazing team. And that wasn't just one person. That was his educational team coming together. The other one, he was at camp. And it's a neat story because it's kind of an out of the box. And I feel like our kids are out of the box. One of my good friends created a camp at their home farm because she couldn't find a camp she liked for her son, and our sons are friends. And so that was a really successful moment. He Cole did not want to go to camp. And he now can go to camp on his own without me there, and just the support of the other kids. So that's a pretty neat thing. The other picture of the girl in graduation, that was one of his community living support workers who was with us for a long time. And so our goal there was she was really important to us and to Cole. And so she was graduating from occupational therapy school. So we wanted him to be able to go. So we actually practiced for him to be able to go to the graduation and sit through it, which was huge. So he did it. So he was successful in doing that, and she graduated. So I feel like that's a positive moment. And the other picture, he had just walked 3 miles with his hiking poles, which was huge. We did a virtual walk. The guy in the middle is his behavior therapist, who's amazing. And the other kid is one of his good friends. So it was a huge success for both of them. So that was really neat. And that took a lot of people. And then for us, the hiking poles were huge. I actually found out about those at another conference, that some other people with Charge syndrome had used them. And so he walked independently for that entire walk, which was amazing to us.
That's great. Yeah.
And then I had to put his trach picture in there when he got it out. And that was a combination of lots of doctors, medical professionals, and therapists to get us to that point. So, so that's our teams.
You forgot your family
more about
photo.
the moments.
Your
What?
family photo needed to be front and center, but I'll
Well,
let you slide
and that's
on
probably
that one.
true because
Right.
that's important. Yeah,
Yep.
and that is a huge part of
Well, I
the
guess
team,
your
is
family was in that last one.
Yeah, they were, but you're right. So definitely family and friends, I feel like, are a huge part of these teams. So they're not nice and neat, but they're amazing. So strategies that helped us survive and thrive. And so we've talked about, let's see here.
So we're doing pretty good. We're about 15 minutes.
Okay.
I
So
think
we've talked about this. Positive behavior supports fits right into a lot of your FBA, your functional behavior assessments, and just being positive in those reinforcers. For example, if Cole, he works towards earning things rather than taking away things. And that has been a life changer. The other thing that was a life changer for us was that if he has a meltdown and he didn't earn it, we found that the behavior could go on forever and ever. So now if he changes his behavior, he can now earn it. So that way, because we were getting stuck that if he didn't earn it, our whole life was ending at that moment. So so that was huge, as he would have like another chance to change and earn it. Being consistent, that's been very helpful. Schedules, we've talked a lot about schedules. And that's huge. We started with picture schedules with Cole, and we have now graduated up to, I use a Google Calendar, and it syncs to his phone. And so that's really, really nice.
So I'm going to pop over there just to
yeah.
the picture and come back for you.
Oh,
Just
okay.
Some sample
So,
schedules.
yeah.
Since we
so
were on that, if
there's
you're
like
okay.
the, and Lily talked some about this, but there's the object schedule. So depending on where they are, object schedule to help them. You've got some picture schedules. You've got written schedules, and then up to the calendar. So those have been really helpful. We've also worked a lot with social stories or social narratives to tell him what is expected. So what's expected in that environment. And we take actual pictures of him in those environments of what we want him to do. For example, at school, when he was younger, he was hitting, kicking, and headbutting kids and teachers. So obviously we didn't want that. So the whole story was about how to be a good friend. What is it? And showing him. And so that gave two things. One, you have the story. Two, he had to practice those as we're taking the pictures. And then the social, I felt like that was kind of a progression for him, was the social narratives and then social skills, teaching exactly what to do in those exact moments and environments, all the way up to social thinking, which is a program by Carol Gray. And that, the goal of that is to teach them to think about the social cues within the environment to know how they should react. For example, if I look at a library and everybody's quiet, I should be quiet. But if I'm at a ball game and people are cheering, it's appropriate to be loud. So trying to teach him to look for those environmental cues.
People have used a lot of video modeling too.
Yes,
so that's
that's a
another
really,
kind of
really good
strategy.
one.
Now with TikTok, you can, for
Yes,
at least for a little while.
Yeah. Okay. Other things that have helped us is we plan in frequent breaks throughout his day. We talked about this a little bit earlier, but teaching flexibility. So truly having blocks of times where we take the time to teach him that something's going to change and you have to be flexible, so that hopefully when things happen that we don't know and they really aren't planned, that we're able to move through it. teaching calming strategies. So there's pictures of his calming strategies when he was younger. He's got a chew tube. He's sitting on a ball with actually his nurse.
The group is asking you to speak up a little.
Oh, okay.
Yep.
So there is, some calming strategies with him sitting on the ball and the chew tube with his nurse. He's in a big swing we have in our basement with his dog. And then he has his iPad that actually does help him to calm quite a bit before, and he was at a doctor's office, and then he has Snoopy there as well. And then the girl with Cole is his buddy. So we found buddy systems or peer buddies in certain environments very helpful. So we homeschool him now, and he is at his homeschool co-op group with his buddy there, and it's been helpful at church or having a peer buddy, and we find kids that are interested in working with Cole and then rotate them, and then that also allows him to get to know more kids and they get to know him. So that's been helpful. We've talked about this a little, is the Just Right Challenge. So in this picture, you see Cole on land with his younger brother practicing going kayaking. And then we made it to actually kayaking, which was huge. But I am certain had we started in the water, there is no way in the world that he was going to get in that kayak. Mm-hmm. So we practiced outside the water. We set him up to be ready, and then we talked about it for a while and even showed pictures, different things like that. And then we were successful, and we made it to kayaking. It was a short kayaking trip, but we made it. The other thing that we do is trying to avoid that power struggle. So if I tell him no, at this point, I'm certain that we have never, ever won a power struggle with Cole. So
I think charge acronym isn't really for the characteristics. It's who's in charge.
It's not going to happen.
Right.
So, we've not yet won. So like in this, the choice for getting in the kayak that particular day, we gave him a choice of two. Both of them were acceptable to me. But do you want to get in the kayak on the land or once it's in the water? So those were both good choices. And he had a choice, so he had control. And that kept us from getting in that power struggle. And then planning for the point of no return. So with crisis management.
So I like how you also just did a slow ramp up, because I think too, even things like trying to go to the store, can we successfully do part of that trip, or we're getting one thing and we're out, and then you end on a success. It's kind of like the baseball or basketball thing. You end on your basketball going in the hoop because you're ending on a positive behavior that kind of retains.
Mm-hmm. Yeah, I think definitely. And then plan for success. So for the homeschool group to plan for success prior to even going, we talk about what's going to happen. It goes back to what we've been saying as far as he needs to know the schedule. And then sometimes we might even need to practice that. And then when we went to Disney, we knew this was going to be overwhelming. So I have a book that was for me, and then he had his very own book. And what we did was we watched YouTube so I could see what rides maybe he liked. He had input, which ones were going to cause a lot of anxiety, so we could avoid those. We talked about the Disney things are going to change, or that you were going to have to wait. So we talked about all of those things beforehand, and actually had a book, and we watched videos of Disney. And then the one picture, he loves Christmas, and so we went to the Christmas parade, and the day that we went, we did not do anything Disney that whole day, because he had to have a break to be able to be successful going there. So knowing what's realistic for him.
I needed that too when I go to Disney, quite
frankly. It was a lot, but we had a very fun and successful trip, and only I think one or two meltdowns that we were able to move through quickly. So
that's awesome. Yeah.
Yeah.
I just want to emphasize, I think this is an extremely important piece, is planning for success and thinking before you get into a situation about whether or not it will be successful. A really powerful question might be, do you think it's 75% likely that this person will be able to handle this situation? If you say to yourself, no, less than that, then probably some modification before you get into it would be really helpful.
Oh, that's awesome. Great advice. So I have two things one thing I wanted to say is just like, wow. Because clearly when I'm listening to this journey, I'm thinking how much energy and time and thoughtfulness and skills that you and your team have done. And I know Cole, who is a wonderfully giving. I'm going to give you the positives. He fundraises. He has a sense of humor. He did this whole little thing, showed me what Dr. Chu looks like without his socks. So it's just he's this wonderful whole package. So I think wow. So we're okay. I'm going to give you the resources page, and then I have another question that we can answer after you go through that.
Okay. These kind of self-explanatory, but these are the resources that have been very, very helpful for us. One of the things that I was just going to highlight is the book at the bottom. That was helpful for me. It's Parenting Children with Health Issues. And I read that and a lot of things. It was about a child who had cystic fibrosis, but the parent, it was written with a parent, I believe, and then a doctor. And it was really helpful and kind of seeing their journey from their perspective of how anxiety provoking it is. And also taught me to give myself grace, that it's okay, that it's not going to be perfect every time and that it is hard. And so that was just one of the things that I found very helpful.
Awesome. So we have a question. One, I just thought I'd go ahead and put our thank you slide up because I loved our statement about it's more than ABC because there are 23 more letters. So I thought you guys were great at thinking that through. The question in the box is any suggestions on how to deal with repetitive questions? Can I watch a movie? 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 When the decision maker hasn't made a decision about the activity because they are weighing different factors or options. So it's not, we don't know if it's yes or no. I've tried explaining my thought process, but what seems too complex, and my 7-year-old just continues to ask the question in rapid fire mode.
We have a wait card. I can say
yeah.
wait, but we actually, I think we talked about this a little bit, but we've had to teach him to wait. And I never thought about that, but we really literally had to teach him, what can I do when I'm waiting? And now he'll ask me, what can I do while I wait? So it started with like a wait card, or it could be a wait picture. And now I can just say, you need to wait. I don't know yet. But that was also like everything. I feel like it's a process. It just doesn't start there. And I'll tell him sometimes now he can understand that. I'll say, I need time to figure it out. And he gets that. But at first he didn't. And so we would just give him the wait card. And practiced that. And practiced it also. That was the other thing, is practice it not in the moment.
Well, and I think even visual schedules, sometimes you have to put other people's activities because there are other factors that come into play when it might be that you've worked through your things, but I've got to go do this. And that's the task that has to get done before the next thing we can do. So just again, that like larger environment. I don't know if there's other thoughts from.
I think that's a great strategy. And I like that you're combining the idea of wait with what you do while you're waiting. And it's great that he asks now. But like you said, usually people don't at first. So you're going to say, it's going to be a wait. Right now you can do this or this. And if there's not a choice that gets made pretty quick, you make the choice as a redirection. Try to get them involved in something else. It's pretty good.
I think just to briefly add on to that, what I really love about what you said is how purposeful you are about planning it in before it's a big issue. And I think something really important to remember is like starting off extremely small. So planning in like a 5-second wait time and then being like over the moon excited about them doing that, and like really explicitly saying like, oh, I love how you did XYZ while you were waiting. Nice job doing that, and being as explicit as you can, because that really helps like reinforce that idea of okay, this is how I wait, and this is how excited my parents are when I act in that way.
Yeah, and I just want to throw another developmental framework because I also know, Cole's 15 and what didn't start there. You really do also have to think about where a child's processing and comprehension is. So these are really great ideas for kids who have those concepts in. If you don't have a first then idea yet, like first we do this, then that happens, it's going to be hard to put a lot of some of these other practices in place. So then it's often more about safety, redirection, and strategies. And I don't know if, Laura, you have thoughts on that.
Yeah, I mean, I absolutely agree. I think from a behavioral perspective, what you're doing when you give someone something else to do is a competing item, and that's the redirection part. Right now we are blah, and you know, if the person's not doing it immediately, you play with it, you try to make it really fun, you do everything that you can to sort of draw them in to what's available in that moment.
Yeah, so we are like 1 minute. Any final like woohoo comments that you made, that you made it? So I'm going to reinforce positivity to our panel because I think they are amazing people, and I'm sure would be willing to be available if you need to talk to them.
I think celebrating where they are right now,
Mm-hmm.
because that was hard for me. A couple years ago, I felt like people were, well, if he can just do this, or if he can just do that, and you hear that, and it's well intending, and of course I want him to be able to do that, but he's enough right now. Right now, if nothing changed, he's wonderful right now. So remembering that with your family.
That's hard to remember, but it's a really good one.
It is hard to remember, especially when it's talking about behavior, because behavior is not always okay right now.
Right.
But
Yeah, no, it's great. Any parting thoughts?
Be hopeful.
Be hopeful. I like
People
that
should
one
be
too.
hopeful.
Yeah. Find your resources. I know that's another hard thing that people find is like even that we had a big conversation about how ABA is a great tool, but if all you're doing is ABA and not understanding the broader context, which is why, you know, this whole presentation went, is that may not always work.
Yeah, and I think jumping off of that, just as much collaboration as you can have across all the different settings, the more successful your child will be, because it's really hard to navigate when there's different expectations everywhere. So if you can have your ABA providers talking to your school team, talking to your medical team to make sure that everyone's doing the same approaches, I think that's going to be really helpful for your child in just navigating this world.
Well, thank you guys very much. It is time for our break. And so at noon, we're going to have a presentation from the Perlman Center, which is a program that works a lot with kids with a variety of developmental needs in a very integrated way. So that will be a fun thing to see. And thank you guys so much. You are I just seek to be more like all of you. All right.